Hello everybody, welcome back to another video. Today I am going to be discussing our first clinical nursing care plans. So if you are in your first level of clinicals, I'm in the BSN program. I'm not sure if it's any different. I wouldn't think so, but if it is any different from the RN program, you might want to check with your clinical professors, or maybe another video would help you more. I'm not completely sure if it's any different, but if it's not any different, then any RN students are welcome as well. But today I'm going to be discussing our nursing care plans and kind of walk through the process of how I like to do these. So these are what our care plan paperworks look like. First you'll start off with their admitting diagnosis. You'll add in any subjective statements about the patient that they might have said that kind of will support your problems, any objective data that may support your problems, the past medical history and the past surgical history that might support your problems. Then at the beginning of your first level clinical, they'll probably start you off with a 1 problem care plan, and then after that go up to a 3 problem care plan. Right now my personal sections on the 2 problem care plan, so I'm just going to be discussing that today. With the 1 problem or 3 problem care plan, it's pretty much the same thing. It's just you'll repeat the process. So then you'll put in each of your problems. So let's just say that our patient has cellulitis, so it would be cellulitis related to whatever's causing the cellulitis. Let's say that it's related to a leg injury, so cellulitis related to some type of post-traumatic injury. Okay, then for each specific problem you'll put your goal. So what exactly is your goal for the cellulitis? You could say remains free of infection unless it's caused by an infection. Then you would say goal would be to lose the infection. And then you would put in the way that you're going to identify your outcomes. We use this SMART, I can't remember the word for it, but it stands for specific, measurable, achievable, realistic, timely. So each of your outcomes are going to have all of those 5 requirements. So you couldn't just say patient will not have a fever. It would need to be your patient will not have a 99.9 degree fever or higher by the end of shift. That's if your patient started off with a fever, then how high it is, it might not be achievable or realistic. But let's just say your patient starts off at a normal temperature, let's just say 98.5, then it would be achievable and realistic. It also is specific because you included the measurement, measurable because you included the measurement, and timely because you included the time that you wanted to achieve this by. So this is our first page. Then on each of the following pages you will tackle each problem. So this is your first problem. You will take from this page each of your 3 outcomes. Let's just use this one. Each of your 3 outcomes, and this is each one of the 3 outcomes that you're going to identify. Then within each of the outcomes, you'll want to include 3 interventions that you're going to use to achieve that outcome, as well as the rationale. Why are you going to be doing this? How is this going to help? And so we have one of these for each of the 3 problems. I'm only going to use 2 of them again because I'm only doing a 2 problem care plan. Then at the end of your care plan, you will look at each of these. This is pertaining to each of the 3 of your outcome criteria. So first one, you would put met or not met, met or not met, met or not met, and then the evidence of if it is met, not met, or in progress. Then you'll have 3 outcomes for each of your 3 problems, and you'll fill it out for each of them. So this is just the basic overview of our blank clinical care plan paperwork. And I am going to go ahead and fill out a couple more things so that I can kind of walk you through how I'm going to be doing this. Alright, y'all, so let's first talk about how are we going to find the data to, create our care plan. So first, I like to think of a care plan as kind of like a puzzle that we're trying to solve. So we need to look at all of the pieces. So first, we'll look at their current medical history. And so this is the current medical history that we're looking at right now. The main problem is going to be the pain, swelling, and drainage from the leg wound. And the rest of it's going to go along with it as well. The enlarging hematoma in the leg wound, cellulitis around the wound, and the rest of it's just a current medical history. So another really helpful thing to look at is your medications. So these are the medications we're looking at right now. I have my medications to the left here, and then I have the reason for the medications to the right. And so, as you can see, whenever I created my original kind of rough draft care plan, I had starred some of these. And the ones that I starred were the ones that kind of popped up the most often. So, we have anticonvulsant, and muscle spasms. And all those kind of go together, so I starred those because that's 3 of the medications kind of pertaining to the same issue. Iron deficiency, there was 2 of them, so I starred them. Antibiotic, 2 of them, so I starred them. And so this is kind of what I like to do, especially for my rough draft care plan before even talking to my instructor, like at the clinical, is create a list of all of the medications that your patient is on, because this will make it a lot easier to kind of visualize what are the main problems with your patient. And so these were what I thought was the main problems. So now let's take a look at what my care plan looks like right now. So right now I have kind of put in some of the subjective, objective, past medical history, and past surgical history for this patient. So we have a lot of information that is kind of helpful to decide what our main problems are. And so with this information, you'll kind of want to look and see what are your main problems with your patient. What is your patient suffering with the most? So now that I have finished my care plan with my 2-problem care plan, I'm going to kind of go over why I wrote down some of the stuff that I wrote down, and I'm going to keep the top part covered up for now because it has some information that I don't think should be shared. But basically, after looking over the medications the patient was on and after looking at different lab levels, I kind of decided on diarrhea being a problem and decreased tissue perfusion being a problem. And I have the reason that I have my evidence for that related to these 2 things. Then I formulated my goals for the patient, and then identified different outcomes that could be measured that would support my goal. So after this, I would fill out the different sections for each outcome criteria, and then the interventions used to achieve this. So basically, something that I learned that I was doing wrong when we first started our care plans was that I was kind of making this more of a general plan. And what you really need to do that'll be better for you, be better for the patient, is to make it very specific to your patient. Instead of saying, will administer medications as needed, you would put, will administer what specific medication that you're going to administer or would need to be administered. So this is for my first problem. Then I have this page for my second problem, and basically each problem has 3 outcomes, each outcome has 3 interventions, and each intervention has a rationale for it. And then at the end of it, you will write down for each problem and for each outcome, you'll write down if it was met or not met. And yeah, so I'm covering up my second one because it also has a little information that I don't know if needs to be shared, but this is kind of just a look at how I did it. And so basically what I would say is the most important thing to remember is that this is kind of like a puzzle. You're wanting to take all of your information that you have and piece it together. So you'll take your labs, you'll take your subjective data, your objective data that you look at during your shift. You'll take your past medical history, past surgical history, and kind of look at all of it, look at their current problem, and see what exactly is similar, what seems to be the most prominent problem. And this is just the ones that I identified, but there could be others for this patient. There could be many different problems for your patients, and what I would just focus on is the one, at least for your care plans for school, what I would focus on is the one that you can see is a big problem, and you can also see that you can get good information on it. Because you might have a problem that you really don't understand and you can't find information on, and that would not be good to use for your care plan because, I mean, you're not really going to be able to formulate a care plan without information. So, yeah, and I think the biggest tip that has helped me is using this little sheet that I just keep the medications on, and it's a really good tip. It's a really good way to kind of look at your care plans. So if anyone has any other care plan suggestions that you think would help me or would help others, you can comment them below. And if you want to see any other videos like this that aren't vlogs, but they're more of like kind of a sit down and talk about some of the stuff that we do in nursing school videos, then you can also comment that below. And if you like the video, then you can go ahead and subscribe down below or like the video. And I would like to see y'all again next week. I post every Tuesday at 12.